The United States is seeing an increase in Mycoplasma pneumonia infections. This has been happening since late spring. The Centers for Disease Control and Prevention, or CDC, is carefully tracking these cases. They are especially concerned about young children getting sick. The CDC is working to make sure healthcare providers know about this increase. Mycoplasma pneumonia is a type of bacteria. It causes respiratory illnesses. These can range from mild to more serious. Sometimes it leads to a type of pneumonia called walking pneumonia. This name comes from the fact that people often don't feel too sick, even though they have pneumonia. The CDC is paying close attention to how these infections are spreading. They are also looking at different age groups to see who is most affected. Right now, it seems that young children between the ages of 2 and 4 are most likely to get sick. Doctors and other healthcare workers need to be on the lookout for this infection. By identifying it early, they can give the right treatment and prevent it from spreading further. Mycoplasma pneumoniae is a tiny bacterium. It is so small that it lacks a cell wall, which is unusual for bacteria. This bacterium is the culprit behind a condition known as walking pneumonia. This type of pneumonia is generally milder than typical pneumonia. People with walking pneumonia often don't feel sick enough to stay in bed. They might have a cough or feel a little unwell, but they can still go about their day. However, even though it's called walking pneumonia, it's still important to take it seriously. The symptoms of walking pneumonia usually appear 1 to 4 weeks after a person is exposed to the bacteria. These symptoms can be annoying and last for several weeks if not treated properly. While serious complications are not common, they can happen. This is why it's important to understand walking pneumonia and seek medical help if you suspect you might have it. Early diagnosis and treatment are key to a faster recovery and lower the risk of any complications. Mycoplasma pneumonia infections often start with mild symptoms. These affect your breathing. You might have a fever, a cough that won't go away, and a sore throat. These are very similar to the common cold or other viruses. This makes it hard to know what you have without seeing a doctor. The bacteria travel through tiny drops. These are released when someone coughs or sneezes. If you breathe in these droplets, you can get infected. You can also pick up the bacteria by touching surfaces that have the droplets on them. Places where people gather are ideal for the bacteria to spread. Schools, daycare centers, and college dorms are common sites for outbreaks. This is because people are often close together in these environments. Knowing how the bacteria spread can help you take steps to protect yourself. Section 4. Diagnosis and treatment options. Figuring out if you have a Mycoplasma pneumonia infection requires a trip to the doctor. They will likely send you for lab tests, especially if you are in the emergency room or hospital. The doctor will use a swab to collect samples from your nose or throat. These samples are then checked for the presence of the bacteria. If the tests confirm you have a Mycoplasma pneumonia infection, your doctor will prescribe antibiotics. These work by attacking the bacteria and stopping them from multiplying. The type of antibiotic and how long you need to take it will depend on how severe your infection is and your overall health. While many people recover from Mycoplasma pneumonia infections with rest and home care, antibiotics are crucial for more serious cases. They help prevent complications and speed up recovery. It's important to follow your doctor's instructions carefully and complete the full course of antibiotics, even if you start feeling better before finishing them. Section 5. Protecting yourself and others. Preventing the spread of Mycoplasma pneumonia relies on good hygiene and common sense. One of the simplest yet most effective ways to avoid getting sick is by washing your hands regularly. Use soap and water and scrub for at least 20 seconds. When you cough or sneeze, do so into a tissue or your elbow. This prevents droplets from spreading into the air. Avoid close contact with people who are already sick. If you know someone has a respiratory infection, it's best to keep your distance until they recover. Getting vaccinated is another important step in preventing infections. While there is no vaccine specifically for Mycoplasma pneumonia, staying current on other vaccinations, like the flu shot, can help. This is because having other illnesses can weaken your immune system, making you more susceptible to Mycoplasma pneumonia. Section 6. Staying informed. Staying informed about Mycoplasma pneumonia infections is crucial. The CDC is a valuable resource for up-to-date information. They provide data on outbreaks, prevention tips, and treatment guidelines. Your doctor is also a great source of information. Don't hesitate to ask questions about your health or the risks associated with Mycoplasma pneumoniae. Early diagnosis and treatment are key to a speedy recovery. Remember, knowledge is power. By understanding Mycoplasma pneumonia and how it spreads, you can take proactive steps to protect yourself and others. Stay informed, practice good hygiene, and don't hesitate to seek medical attention if you experience any symptoms of a respiratory infection.